Hey, we're going to get going here. Welcome to our virtual training on safe work practices for the COVID era. This training is brought to you today by Safe Build Alliance and Latino Built through a grant from Oregon OSHA. I'm Leanna Petrone, the Executive Director for Latino Built. This training today is being recorded and distributed to our community following the presentation. Please make sure that your mic is muted and stays that way through the duration of the presentation unless we instruct you to do differently. For questions during the presentation, please ask them in the chat box. They will be answered throughout the duration of the presentation, and then we'll open up some questions after the presentation is complete. I would like to introduce Elizabeth Flores, MD of House Call MD.
Good afternoon. Okay, good. It's good to see you. I'm going to share my screen. I am Dr. Elizabeth Flores. I work with House Call MD. Basically, it's my private practice. I do specialize in the care of older adults. So I am a geriatrician, but I trained in family medicine as well. So a lot of talk about prevention and health and how to stay healthy. I'm going to share this screen now. You all see my screen now? Yeah, okay. So this talk is really about working with COVID-19. And what that means is really when you work, but also how do you live with COVID-19, because it is not going away. And so pretty much a lot of the things that apply to your personal life should definitely apply to work, with some variation and adaptations depending on where you work. So my goals today are to just briefly review best practices for infection prevention. I think that you can never hear it enough. I think that the more we hear it, the better, because maybe that way we will actually be doing a good majority of these measures. I'd like to review some Oregon data for the state of Oregon as far as COVID statistics. We'll go over what is phase 1 reopening for the state of Oregon and what the guidelines and requirements are for that, so we can understand what our part is in that. We'll explore what you and or your business can do to help prevent outbreaks. And then we will talk about hoping for the best and preparing for the worst. So let me see, give me a sec. Okay, precautions. Basic stuff, but we should all do it, and we should do everything as much as possible, or else it does not work. So COVID is spread through our respiratory droplets, through contact of items that people with the infection have touched or coughed on. And so you must stay away from anyone who is sick. So that's why people are quarantined and are using their own bathroom and their own utensils, and they're sleeping in their own bedroom for at least 10 days. Physical distancing is important for the same reasons, to prevent spread. We talk about 6 feet and definitely avoiding large gatherings, which is starting to change as we're starting to see a reduction in the number of new cases of COVID. We'll talk more about that. Cover your cough and your sneeze always. Don't touch your face, especially if you're outside when there's more people around you, or you're going in and out of buildings, doorknobs that you're touching. Nose, eyes, and mouth are portals of entry for the virus. Always clean surfaces with alcohol, especially 60 to 70% alcohol, isopropyl alcohol. High traffic surfaces, doorknobs. If you're in your office, clean the counters as much as you can. Same thing with the hand washing. If you have access to soap and water, do so for 20 seconds, especially after you leave after you came home or back to the office from going outside, or in between when you go to the bathroom. And always good to have a hand sanitizer on hand. And of course, if you're ill, you should stay home. So this is important, especially if you have employees or for yourself, just reviewing the symptoms of COVID. You probably have heard it many times. Always good to know and have it in your mind. A dry cough, a fever are the most common, but not the only ones. Headache, sore throat, shortness of breath, diarrhea or dizziness. The loss of smell and taste is an unusual one, but has been noted, so it's good to mention. Anytime you have this, you should stay home. If you have someone you work with, you know somebody you work with, they should be sent home. Now that we are in an era of do-it-yourself with face coverings and such, a lot of people are also making their own hand sanitizer, especially when you can find it in the stores. So I'm leaving you here with a recipe for how you can make your own at home. If you can get a hold of some isopropyl alcohol, about 70% alcohol, and some aloe vera gel, then you can make your own hand sanitizer. You bake about a cup total of the sanitizer, and you use some hydrogen peroxide, a couple of tablespoons per cup, and a few essential oil drops are helpful if you have them. Eucalyptus, tea tree essential oil. And you mix it all together and you have your own, have it in your office, have it available. There's no reason not to have it unless you just can't get a hold of any of these ingredients, but hopefully you can now. Same thing with the face masks. A lot of people are making their own, which is great for the community. The double layer cotton ones are great. A word on masks is that they are meant to help protect others from you, so that if you're infected or if you're coughing or even just breathing, just talking, you don't spread it to others. So it's not as effective. And Liana has a great Latino built face mask that I think is awesome. Oh my God. It's a good size, covers the nose and the mouth. So that's actually a really good looking mask. Note that you can still breathe out through the size of these face cloth face masks. Same thing with the surgical, the one, the top right, they're the surgical masks that you see mostly in the hospital. They really are meant to protect others from your own droplets. They will help you, they'll protect you somewhat as well. So they're still good to use. As long as you're using that and not touching your face and washing your hands, then you're really improve your chances of not acquiring the virus. I like to mention the N95 respirators because these are the ones that are mainly seen in the hospital, in the ICUs, when you're actually contacting people that have COVID. These are fitted for individual people. They have to be tight around the nose and around your jaw. And so that means that you can't really get any air out or into it. So they're quite uncomfortable to wear for a long time. Nurses, doctors, I'm sure they know, they've seen this. So it's not a long term, it's not easy to wear these all day long if you have to wear something all day long, which is why the ones above are more usable, reasonable to use. I like to mention the N95s with the valves. These are usually, they're one-way valves. I see them in construction, so that's why I want to mention them, because they're really meant to protect you from like dust and asbestos and that kind of work, right? But it doesn't prevent your breath coming out. So it's a one-way valve, so you can breathe out, so they're more comfortable to wear. But these should not be used in public. You're not protecting others from you when you wear this. You're protecting yourself, but the idea is that you're protected when everybody else is wearing masks. And it's really not, it's half the job. It's actually, they're not allowed in some cities. They're for work, that's it. Okay, where are we now with Oregon statistics? I think it helps to just look at the state, because this is where we are, and it's good to know what our risk is in our state of exposure and of disease. So for Oregon, we have close to 4,400 total cases of COVID-19. And over half of these cases are people who are 30 to 59 years old. So right in the middle, And these are and interestingly, this is not where the majority of deaths are coming from, right? So the 30 to 59-year-olds can acquire it, can spread it, but we do know that the 157 deaths, maybe more like 160 now, here in Oregon, in the state of Oregon, where people over 60 years old, the majority, 95% of them. There are no children, no one under 18 who's died from this here in the state of Oregon. And 45% of that number is the people over 80 years old. So this is a high risk population. This is a 3.6 mortality rate compared to the nation. The US, this per the CDC, we're at about 6% mortality. So a little bit better for Oregon. That means that close to 4 out of 100 people infected die with COVID. And this is the table where I got some of these numbers. You can see more. You see the number of deaths for 0 to 9, 10 to 19, 20 to 29, 30 to 39-year-olds is 0 for the state of Oregon. This is, and of course, also very low percentage of actual cases in that age group up to 19 years old, which is why we talk about children not being vectors of infection and not actually carrying a high disease burden, which is why the state is talking about summer camps and daycare opening. They are open with some restrictions, I think, with numbers of people that can be together. Okay. And 33, it's interesting, 33% of the cases are Hispanic. It's about a third of people. And I think that's just because of the kind of work and industry that people are in. They have more exposure. Okay, this is a table that just kind of helps us see where the state of Oregon is with the total numbers. And we can see in the middle of March, we peaked. And then we kind of came down, and it looks like we had a second peak early May, and we're starting to come back down, as you can see, end of May. And this is what the state is looking at to help us determine when we can reopen businesses and offices and such. So this is what the state is looking day to day to determine where we're headed. So the other table here is showing you the number of people that are hospitalized with COVID, so people with severe disease. And that number is also going down. As you can see, the orange line here is showing you the average, the 7-day average of people that are hospitalized with COVID. So as long as this number stays down and it doesn't start to climb back up, we are good to consider our reopening, which is what we've been seeing already in most of the state, and which is why a lot of the majority of the counties in the state of Oregon have already been authorized for phase 1 reopening, which we will talk a little bit more about. Am I missing? No, I'm not. Okay. So this is the data that the state is looking at to determine the ability to reopen, and it's happening by county, and there are some regional criteria. So, and each county needs to apply to show the state that they are ready to reopen. So we need to see that the number of people with new cases of COVID is going down, or at least staying the same. Basically, it's not increasing over like 7 days. So as long as that number stays down, doesn't change up, we're good, which is why we can do our part to help spread the disease so that we don't have to have restrictions again, because we're not done with COVID, and restrictions can be reinstituted at any moment if we see outbreaks and we see the number of people in the hospital climbing again. We need to be able to have minimum testing abilities in each county, and that's established by the state. So many tests and labs need to be available per certain number of people. And we do have number 1 and number 2 for, I think, all the states. Contact tracing system is a new thing, and if anybody out there wants to look for some work, the state of Oregon is looking for people to be tracers, which means they call and contact people that have been exposed to a person that is diagnosed with COVID-19. And this is going to be very important, very vital part of reopening, because it allows us to really closely trace and know who are the people that have been exposed, and we're going to ask them to stay home for about 10 days. And this is how we prevent that surge of cases. So contact tracing systems require people working, and we need to have so many people available per population. And because Multnomah County is most populated, I think that's where we're still working on having the right number of people to do these calls. Isolation quarantine room capacity. So counties need to apply and show that they have either hotel rooms or shelter places where people can isolate when they're not able to otherwise, if they're diagnosed with positive COVID. And we also are seeing that we have sufficient hospital capacity and supplies for personal protection for hospital workers and first responders. And that is why we're also have gone through to phase 1 reopening, as long as we have sufficient healthcare capacity. That was the biggest scare about this disease, that it spread and that it was quite a high mortality rate compared to like influenza, which is a 1% mortality rate. And we were seeing in Europe close to, it looked in some countries, 10% mortality. So here in the US, we're about 6%. The state of Oregon is even better than that. So know your risks, know where you are, and then act accordingly and according to what risk you're willing to take, and know how to help your state stay open. This is just a summary for this is just a website in the Oregon Health Authority where you can see where each county is. And I just wanted to make sure we have Multnomah County in there, where what's missing is the ability to trace new cases to a source. That needs to be, 70% of people we can trace to a source. If we're not able to trace to a source, then that means it's pretty widespread in the community still. And that's set at 30% of people that are not traced to a source. And that's a really important criteria for whether to move on to opening phase 1. And everything else, we're okay for Multnomah County, pretty much. What is phase 1 reopening? Maybe we've heard a lot about it. Statewide phase 1 reopening means that we are able to do some recreational activities. We can go out and exercise. Day use parks are open. Still following the distancing protocol. If you're in a crowded space with more people, wear the mask, hand washing, all that stuff, still part of it. Childcare, summer camps are planning to be open with probably some number limitations. Standalone retails, jewelries, like little stores are also able to open as long as they keep that distancing of 6 feet between clients. By counties, it's a different situation. That's every county needs to apply to reopen. So what does that mean once you're approved for phase 1 reopening? And what does that mean for your business if you have any of these businesses or just your employees decide to go use these businesses? So gatherings of up to 25 people will be allowed. This does not mean that travel is allowed. So it's for local groups. Restaurants and bars can open as long as they keep a 6 feet distance between clients and their workers are wearing a mask. So still with the measures to prevent spread. Personal services like barber, a massage therapist, all those things can open with requirements of keeping a list of clients, knowing who they are, when they showed up, only make appointments so people go in when they're ready to go in, and so that they avoid waiting room space usage. Gyms, fitness centers will be allowed to open, same thing with maximum capacity limitations. I know a dance studio I go to in Hillsborough, Washington County, is reopening this week. They can only take 12 students. So that's kind of what people have to do. And counties need to stay in phase 1 for at least 3 weeks before considering phase 2 reopening. Phase 2 reopening is just basically bigger groups. I think it will still be defined, but it means also like opening nursing homes or assisted living facilities to visitors, maybe larger groups of gatherings can happen. So that will be defined as we progress. But just because we're in phase 1 doesn't mean we're going to only go to phase 2, right? We can go back to restrictions if we see spikes and a great number of new cases. So right now, phase 1 reopening has been approved with most of the state of Oregon. I don't think Multnomah County is approved yet. Hopefully in a couple of weeks. They need to apply, they need to show that they have all those prerequisites met, and which most of them are. I think it had to do more with tracing, that, and I don't know if it's, yeah, I think it may have to do more with staffing to have the people available. Let's see, what do I have? Okay, so just the 3 things I want to mention about the reinstitution of restrictions. They can happen, and they will happen if counties are not able to meet their contact tracing requirements. And there are specific guidelines for that with numbers. I don't need to bother you with numbers. You can look them up on the website, but we need to have so many people available per population, and we need to see that people are traced back to a source of COVID, so that we feel safe that it's not widespread in the community. If we start to see new cases that are going to the hospital, more cases over 7 days, or more new diagnoses over 7 days, depending on how that's going, how that's trending, we may have to reinstitute restrictions on opening businesses and such. The website, the Oregon Health Authority has a website with some good guidance about employers and businesses and what that means to each one of you, depending on where you are. See, there's this same website. So I don't know. I know some people are in construction. Many people are in construction. Many people are working in the office. So it's a whole different thing. I think that people in commercial construction were probably doing okay. Work could continue. They probably were able to move faster. So now they may have to cope more with more people coming out. And what does that mean, right? That's why it's even more important to be aware of how to avoid contact, how to stay clean, how to clean surfaces. So that's where, and maybe dealing with more people going in and out of buildings. So that's where I see construction and then the construction industry being affected. Perhaps a little bit different for like residential companies. So this is more about if your client contacts you, they're ready, they can have you in their home, and it's about just keeping that protocol of you wear a mask when you're talking, and if you can make sure that no one's around the house when you're working on the house, better. So, and if you're in a room all by yourself and no one's around you, you're okay to not have a mask. So it's about knowing what the risks are and what you can do, what you should do to protect your clients as well. And so, and because you want them to be comfortable. So of course they will be if they're contacting you, I think, but you just got to tell them or let them know that you are aware and you know what to do. In the office, the same thing. If you can, if anyone's sick in your office, please do send them home. We talked about the symptoms. They should stay home for at least 72 hours after their fever went away or any symptoms went away, 3 days. That's presuming they got better. Anyone who gets worse and needs to be tested and then they test positive, then that's a whole other protocol. That means they're quarantined, they're staying home at least 10 days with absolutely no contact with other people, even with people they live with, if at all possible. And there are guidelines that we can talk about with how to take care of people who have it. It's really about just not sharing anything, if at all possible, bathrooms and such. So the cleaning of your surfaces with alcohol always, and talk to your employees or anyone you had to send home every day just to make sure that they're okay, they're getting better, just so that you know about whether you need to refer them to any new resources. I mentioned this already. The face mask, again, if you're with other people, I think, yeah, if you're not around people, of course, it's not necessary. Yeah, telework if you can. Still, it's here with us. Keep using it if you can. We're not in the clear, like I said. And last, a little bit of, so I want to go back to boosting your health and what COVID means to you personally. And your employers because you do want to have healthy employees. So we do know that, like I mentioned, most people that are dying or having severe disease from COVID are older. They do also, and the majority of people have chronic disease, such as diabetes, obesity, hypertension, smokers, lung disease. So that's something that you can do. That is to take care of these conditions. Do not ignore them, stabilize them. Some of these, actually, many of these, I actually can almost say all of these chronic diseases are curable. You just gotta be willing to make a whole lot of change. And then last, boosting your immune system would not hurt you. We don't know exactly what it will do with COVID, but it would be helpful if you could help boost your immune system. And the two things that I hear a lot that are used and that seem to really help with immunity are taking high doses of vitamin C, which a lot of people take in the winter months for flu season. It's usually about 1,000 milligrams per day, and they have them in little powder packets you add to some water. And also the practice of intermittent fasting actually helps give your body a reboot and energy boost and an ability to actually take care of what really needs to be taken care of. Because when you're eating more, you're putting in a lot of energy to digesting and processing all of that food. So that's the reason, that the idea behind why fasting actually can help boost your immune system. And again, there's a way to do it, and there's a way to be healthy when you do it, and good to talk to healthcare providers about it. It really is about doing it with good hydration. Am I missing any questions? I'm gonna wrap it up here and look to see if you have any questions about, and I do have a website. Feel free to message me or call me if you have any more questions, or if you want to know how I can help you personally, or your company or your employees thrive and stay healthy.
Hey, Elizabeth, can you go back to the slide that was right before the boost your immune system? Yes. Let me just get a screenshot of this. Thanks.
Mm-hmm.
Just to clarify, when is suggested that you wear masks, particularly, I mean, in everyday life, but also in the office setting?
It's really, if you're going to be closer than 6 feet to other people, you should wear it. It's really about understanding how you increase those chances. So if the closer you are, like, anywhere from touching somebody to like a foot away, and then if they're not covered and they're sneezing and you're with them talking for an hour, you're going to have it. You're going to get it, right? But if it's someone who's not really coughing, sneezing, not really sick, and it's 10 feet away, you're probably going to be okay. And if it's only 10 minutes, you're okay. But again, it's about the risk that you're willing to take. So know what increases the risk and when to be more cautious, but also know that if you need to catch a fresh breath of air, that's okay if you're not around people, or you can just go outside for a bit. I think it's a combination of everything else, the mask and the cleaning your hands, and if you're near other people, don't touch your eyes. It can go in through your eyes, and we are not all wearing face shields, right? So it's usually through our fingers. And same thing with the nose and the mouth. So definitely, I think the face mask is really for like when you're in more crowded spaces, for sure. In the office, it depends on how many people are there, and it depends on what other people are doing. And if you just don't want to count on everybody else doing their part, then you may have to be extra cautious. So the more people that do it, then the more we're all protected.
So if we wanted to conduct a class, let's say in our conference room, like office conference room, and we had our staff members or employees or whoever attendees separated like every other chair. That's not quite 6 feet. So your recommendation would
A
be
mask.
for them to
Yeah.
wear a mask
Yeah.
during that 1 hour session.
Yeah.
Okay.
Yeah. In person. Yeah. That's why they still highly recommend Zoom meetings and telework if you can, because it's
Okay.
the more you're in groups and closer together and longer, the
Mhm.
more likely you're to spread it. So definitely a face mask then.
Okay.
And that's actually for phase 1 reopening, they're saying that they will allow like up to 25 people to gather. So that
Right.
doesn't mean you get to go and hug and kiss everybody. You could, but just know the risk and know that if anybody else is sick, or just know that. Or if you actually touch somebody, just wash your hands and don't touch your face, things like
Or
that.
if you feel compromised, like if somebody has low immune system or any of those little like heart conditions that they talk about.
That's why I say if you're compromised, like you really are, you're going to be compromised if you're having a state of a chronic. It's very common in this country and many countries too, and it has to do with what we've been eating for the last 50 years. And that is a chronic state of inflammation is what makes you more prone to have a poor immune system and therefore get real sick from COVID. And so the cause of that is really a lot of sugar, bottom line, a lot of sugar. What is sugar?
So I have to cut my
juice.
wine intake.
What's that?
I have to cut my wine intake.
No, actually,
Good.
no.
There's sugar.
Good
in
answer. I've heard it from a doctor now.
One glass a day is good. Red wine.
Yes.
It's all good. No, it really is like the juice, the soda, the fruit, even potentially the table sugar, bread. I mean, bread, cookies, cake, even pasta, rice. They all become sugar. They're all sugar in the end.
All the starches.
So it's, the really high sugar items you cut out, the other ones, the minimum possible quantities, and then maybe even revisit with your doctor if you have diabetes or whatever else, maybe hypertension, because so much of it is curable when you're eating the right way. And that's what I mean about chronic diseases. They're all potentially curable, and that's what you can do to boost your immune system and be strong in case you get it. I always tell people, prepare to get it, prepare to pretend you're gonna get it, just like with the flu. We do what we can. You drink your teas and you try to do it. We cover up. That's actually, you cover your neck and maybe even and in the winter it works because it's cold, so you're actually protect. It's like your mask against the flu. Same thing with COVID, and even more so because more people die from it than the influenza. And we don't have a immunization. We don't have effective treatment. So that would be phase 3 reopening when we have that, which is why concerts, baseball games, that's not happening this summer. Not even the fall, probably. Big conferences, you're going to have to keep them smaller if you want to do it in person. But phase 3 is when we do have some effective treatment or a vaccination, which is kind of what we have for influenza. So, yes.
We have a question from Karen. She was, with all of the demonstrations and we've seen a lot of protests and what have you with large groups of people, what kind of increase of the virus are we expecting to see?
You would expect it to rise, and there may be a couple weeks lag time. We only hope it doesn't rise so much. Remember, we were talking about when or what would trigger the state to revisit the reopening, and that is if we see a rising number of cases. And I think, and the biggest one is if more of them are getting hospitalized. So as you see, it's the younger people, that middle, group people that carry it for the most part, and it's the people over 80 or over 60 that are dying from it for the most part. So it's more about where these people are going. So, and some of these people may never know they had it or may never be tested. So a lot of the numbers depend on how many people are actually tested. We are seeing a lot. We are having a lot more testing capacity. We are seeing that. So I wouldn't be surprised if there's a rise. I'm hopeful. I hope that the virus has changed enough, that it's been around enough that people will not get us sick or whatever. People were wearing the face mask, but again, that's just one thing, right? You're close to people, you're touching people. It's not gonna do it. It's not gonna do it. So yeah, there will be a rise. I just hope, my hope is that it doesn't go to levels where they're gonna tell us we need to reclose. And again, people will still do whatever they want. There's a lot of people that believe we should have stayed open and being open long ago, right? So it's about knowing your risk and knowing who you are and knowing what the mortality rate is and knowing that we don't have vaccinations and just how to stay healthy for you and your immediate family and friends and workers.
Yeah. So kind of more of a suggestion rather than a question, but maybe Elizabeth can reaffirm it. We are suggesting that all small businesses have really a plan for your employees. The reason employees are going to come to work sick is because they're afraid of losing their job. They're afraid of losing their job. They're afraid of not having an income. There are so many benefits. There's workers' comp that if it's proven that it was COVID related, obviously if they get they were tested positive and they could prove that they got it from work, it's going to be covered, and you as an employer are going to be covered as well. Mm-hmm. So important to have a plan for your employees so they don't come to work sick and spread it.
Yes. Yeah. See, it depends on the size or how you speak with your employees, but I think it's good to kind of be proactive or anticipate in case they do get sick, because they may, if they don't know what could happen or what the options are, they may just come to work. So there is the, what was I going to say? If you need to have it in writing, that would be really helpful. But we're going to be better off preventing the spread, and people need to feel safe to stay home. This is a very different situation where, like in the past, we used to think, oh, we could just show up. It's just a little cold. I'm okay. Any symptoms should be taken seriously right now. So communicating with the employees about what you would do, what you want them to do, what you expect them to do, for when to stay home. If they tell you I have a fever, you should definitely send them home. Wait and call them every day. How are you doing? And yes, there's either I don't know if there's workman's comp or if you have, there's a lot of state support once you have if you are actually positive. And of course, we know there's a lot of the business support, if you can find it, if you can get it, for in case you have to send a lot of people home. What we're seeing right now is that outbreaks in facilities where people are working together, like Red Bob's Mill had an outbreak in Clackamas County, like last week, 13 cases. So, and they're considered to be like, it's low risk in that we know where they came from. So it's not like they all got it from somewhere else. And so it can be contained as long as everybody does what they're supposed to do. So that's what the state of Oregon is also going to start monitoring. So any company, any packing company, any like vegetable meat packing company, if they have the state is actually going to record outbreaks, because that's kind of where we're seeing it, where we're seeing that it's hard to stay away or not be in crowded spaces, and how do you clean surfaces and cover yourself. It's something that depending on the industry, has to address.
Especially, I guess with the warehouses and whatnot. And I'm assuming that they're going to also do tracing too.
Yeah.
With those 13, because of course, as we know, that extends reach.
Yes. Yeah, the contact tracing is something that it takes staffing, it takes workforce to do it right without any good technology where computers could do it for you. So it's something that, really needed to happen from the beginning, but it's a way to really let people know you've been around someone who is tested positive, you need to stay home and let us know if you get sick. So that's just a way to contain it. And that's what we're trying to do to be able to continue to open more and more.
So I have another question. We have, whether they're Latino or whatever, sometimes we have people who live in multi-generational housing, or even just with your own children. For mine example, if my child gets a fever, and let's say that, and we don't know that, it's necessarily COVID, what should I do as living in the same house and their caretaker? Do I no longer go out into public? Do I wait 42 hours? What do I do?
Yeah. I think it's those, you still would want to apply that 72-hour rule. If they don't, let's say they don't get sicker, they had a fever maybe, and then they started getting better. Because you're a caretaker, you got to be there with them and they're dependent. You can't avoid contact. So I would definitely I would think of it as if you had the fever, almost like, I'm going to stay here for 72 hours until, after they've gotten better. Again, yeah, children carry lower risk as far as getting sick from the disease or even spreading it. So, but it's more like even the spread, like, I don't know what it is. Do not ask me why, but it's been said more than once that they've looked at studies. There was even one in Ireland where they traced back a few children that were tested positive while they were still in school, before schools were closed. They went back into the community and they're not finding that they were spreading the disease. They were not spreading the virus. So children are just somehow sparing that spread and the burden from disease. So it's not a bad idea to check in with a pediatrician. They may tell you something different as far as what you should do, but I think you're not going to avoid that contact with them. You can't. And so that's what I mean about know the risk, know that the risk is low, and take your risk. And, it means know that you're doing it with having the mindset that I have a low risk of getting it or even of spreading it if I take the measures of washing my hands and put on the face mask when I go out, all that. So, because we're not 100% clear from risk, no matter what. So in every situation, there may even be grandparents who are like, I don't care, bring my 5-year-old grandson here. I like to see them. And it's up to the families to decide how far do they take it. Especially when it's in their home, especially if they're not at an assisted living facility where it's more crowded. I would almost look at it differently than a bigger space with more people. So, because I am seeing a lot of people getting more anxious, depressed, and debilitated from isolation. So there's a balancing act there.
Thank you. Do we have any more questions? I'm going to put on my mask one more time. Hopefully you can still hear me a little bit. So
they look comfy.
Yeah. So before I changed my screen to tell you about our promotion. So
can you do that one more time? I didn't get a screen capture.
Oh, you did it? Okay, hold on one more time.
We should have brought our
I know.
masks.
Get up close there. Alrighty. There we go. Thank you.
Okay, now I'll share my screen for our contact information here. Thank you, everybody, for coming in, and especially thank you to Elizabeth and all of her knowledge, and trying to really keep us safe. It's amazing. Please, if you guys have more questions, email us. We have a great website that has so much on it. We have a brand new safety website to keep you safe. It has COVID resources as well as all other job site, you name it, safety things. We also have a COVID designated website that you can find on our website too, for just specifically that. We have a Facebook please like us and follow us there, as well as LinkedIn. We also have a new Instagram account. Our newsletter is filled with lots of things that you need to know. And then most importantly, again, that mask, okay? We need you to subscribe to our YouTube channel. This video will be posted there, as well as many other great resources for you there. And so subscribe. If you subscribe and you're within, I think we have about 15 left to give away. You will get one of these great Latino build face masks to keep yourself safe there. And once again, we have to thank Safe Build Alliance. They've been an amazing partner with us, able to do these free safety trainings here and additionally. So thank you everybody for coming.
Thank you, everyone. It's been great to have you and to be here with you.